The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. I have with me, I believe it's the third time on the program. Always excited to have her here. Sharyn Weiss, say hello.
Hello.
So glad to have you here. We're kicking off this quarter on fire. I think you have, I'm going to call this somewhat kind of a little, what's the right word to say here? This topic that we're going to talk about today is going to, I think, blow some people's minds and make them really rethink the way that they are following up with their patients. But before we get into that, go ahead and tell us a little bit about yourself. Tell us about your business and how long you've been helping dentists.
So I'm a practice management consultant, and I've been in this field for over 20 years, God help me. And in the last 3 or 4 years as the CEO of my own firm.
Yeah, that's awesome. So I know you got a ton of experience. You work with practices all over the country. So let's just jump right into our subject today. We're going to talk about using text and email reminders with our patients. So what do you think about it? What do you think about dentists doing that?
Let's talk about it in the big, like the whole confirmation / reminder process, which is ripe for just disruption, because this whole process, I think, is ridiculous in the way that we're approaching it. So the first, let's look at our own mindset about patients. And the dental industry mindset seems to be that patients will never remember their own appointments without us contacting them over and over again to confirm what, frankly, should have already been their confirmed appointment. And we have so little faith that patients will take responsibility for themselves that, dentists spend enormous amounts of money and time and energy sending texts, postcards, emails, phone calls to, quote unquote, remind these patients to show up for their own dental care. And this is an absurd process. It is actually backfired, because now we've trained patients to be so dependent on all of these messages that patients will say, oh, I didn't remember because you forgot to remind me an hour before this appointment. And so the locus of responsibility has completely changed from the patient to the dental office.
Sure, that makes sense. So what are you supposed to do instead? So this came out, by the way, and because there's a real problem, this technology came out and the ability to do this and the, paying a couple $100 to $300 a month to have this service within the practice started because patients were no showing for their appointments, right? I have to imagine it wasn't that everybody was showing up and we were like, oh, let's fix something that's not broken. So there is an issue with patients not showing up. So let's separate these two. Let's first talk about, forget the technology exists. Why don't patients show up? What caused the problem in the first place?
So let's look at something very sad, right? It's kind of sad. Women do not need multiple reminders to go to their hairdresser appointment, right? Nor do we probably need it for the latest Botox injection. And I suspect even other doctors' offices, like the oncologist or the cardiologist, don't need to remind their patients over and over to show up. So what, to me, this speaks to is just a lack of value for dental care, right? And so where this has gone is that patients do not see the value, especially of their regular hygiene care. And so this is something that, quote unquote, slips their mind, or they find something that is more important to do on that day and thus cancel their appointment. So really, the origination of this problem comes from the lack of value. But again, We have to look at our own behavior and how we created that problem. And one thing I'll notice, almost every dental office I've ever worked with refers to their hygiene appointments as just a cleaning. So if your patients think that what happens at the hygiene appointment is quote unquote just a cleaning and pretty much equivalent to getting my car cleaned or my carpets cleaned, then sure, I'll do something else if that time becomes inconvenient, because it's just not that important.
Yeah. So you're right. I've heard this. I hear this all the time. I might even hear it at my own dentist practice. Do you just need a cleaning? And you're 100% right about that. So basically you're saying, increase the value of what you do to the patient. Or you actually can't increase the value. What you can do is increase the perception of the value, right? The value is not really changing based on a few words, but the perception is, and perception is reality, and that'll help. So besides not saying just a cleaning, tell me, what can we do to increase the value of the perception of value in that, twice a year or once a year cleaning for patients?
Right.
Three hints.
Every single appointment should end with a debrief by the hygienist or dental assistant or even doctor, talking about the value of the next appointment, meaning what are the benefits of the next appointment to the patient, not to the practice, to the patient. And so if the patient is concerned with aesthetics, great. We're making the case about how the next appointment is going to help with that. If the patient is concerned about finances, great. Then we're making the case about how the next appointment will continue to reduce their dental care costs. So every communication has to be about, the old what's in it for me, right? And that has to be communicated really clearly.
Makes total sense. So anytime you talk about a feature, right? The features, you're going to get a cleaning, and we're going to do this, this, and this. We're going to scrape off some plaque. You have to talk about the benefit of that, or there is no value, correct? Like we all have anti-lock brakes on our cars nowadays, unless you're driving a classic car. But that's the feature. The benefit of anti-lock brakes is that your brakes won't lock up, cause you to steer and crash, and potentially really get hurt. So you have to talk about those the benefits of those features. So increased value, that's also going to help you in other areas, right? Not only is your show rate going to go up, your referrals are going to go up, right? Case acceptance, I would assume, is going to go up, and probably the way that you value what you do in the community is going to go up, right? If you're constantly talking about the benefits of what you do with your patients, you're going to go to work, and your entire team's going to go to work feeling like, hey, there's a lot more to what we do every single day. There's a lot to be happy about and to feel satisfied in our work about. So sorry to steal that, but it's exciting. I've never really heard anyone present it the way that you did. So let's jump into the part B of this. So I don't think very many listeners are going to go, hey, okay, yep, tomorrow I'm going to start building value, and I'm going to drop my texting and email service. You probably wouldn't recommend that they do that right away, would you?
I'm not saying that you need to drop it. But as an ex-English major, I am going to say you need to pay attention to the language you're using, because the language that I'm seeing is backfiring and undermining the message about value. So when the appointment coordinator or hygienist is making the next appointment, the language they should be saying is, fine, your appointment is now reserved and confirmed for X date, right? We're looking forward to seeing you. Would you like us to send out a text message or call you? So let the patient decide. Okay. Yeah. So now the appointment is reserved when the patient made it. And that means to me that it's also been confirmed. So sending frequent emails saying, could you call us or click on this link to confirm your appointment, is completely misleading. The appointment was already confirmed. And if you're asking the patient to confirm it again, multiple times, then what you're saying is the appointment is kind of squishy, right? not really
Right.
happening. We're not even committed to it yet until you tell us you're gonna commit.
Yeah, makes total sense. So, give us one more little hint and tip. Give us, in your experience, what's one more thing that we can do to increase show ratios?
Okay, well, I would say that if you're going to send a text message or these reminder messages, they have to be under the assumption that the patient is coming. So the message should read, we're looking forward to seeing you on X date at X time. Please let us know if there have been any changes in your health or oral health, and if you are taking any new or prescribed medication, new or over-the-counter medication. Now, this message actually helps the appointment, right? Because one, it's saying, we know you're coming. So the only question is now we need some help to make sure this appointment runs smoothly. Wouldn't the office like to know that, the patient's been taking aspirin for the last 3 months, right? Or they had that knee surgery 4 months ago. Those kind of questions and that information would help make the appointment run smoother, and doesn't ask the patient to confirm or say, we don't think you remembered to come. So we're calling to apologize about reminding you for your own appointment.
Yeah, makes total sense to me. I want to send our audience, remind them, check out your website, join in on the conversation on Facebook too, but it's weisspractice.com. I wanted to make sure that we got that out there and encourage our audience to check out your website and learn more about you. One more question that I have for you. I know I've asked you this question in the past, but I'm going to ask again for new listeners. Tell us, if you're looking to find a consultant to help you with these things, you need someone to boost you up and help you get to where you're trying to go. You kind of need a second-hand person, if you will. Tell us, what's the best way to go about finding and vetting someone to help you?
So finding someone in general or finding me?
I'm saying the consulting things to help you with these types of things that come up, and a lot of them we know, we're just not reminded of. Mm-hmm. So to help as a consultant, like someone like yourself.
So the first thing actually is, don't look for a consultant first. Look inside yourself first and answer questions about, what do you want to achieve specifically, right? What would mean success for you if you were working with a consultant? So I would want you to have very specific and ideally measurable goals. Or you'd be saying to yourself, no, I just need someone to be a venting source, right? Okay, that's all right too. But be really clear first about what you want, how you would measure success, and why you want what you want. And then, based on your own answers, you could look for consultants that fit that criteria or have that expertise.
Yeah, makes total sense to me. Sharyn, thank you so much for coming on the program. Again, I want to encourage our audience to check you out. And thank you again. We appreciate it.